Abortion is legal in Canada, but could it be harder to access here in Alberta? Politicians debating if physicians should have the conscious right to refuse that service and a referral to another doctor if it conflicted with their moral or religious beliefs. But critics say it's a backdoor to restricting women's rights.
Currently, if physicians refuse services such as abortions, contraceptions, and medically assisted deaths, they must make a good faith referral. But that could soon change.
So that these professionals never have to choose between the most deeply held convictions on one side and their jobs on the other.
Introducing the bill, United Conservative backbencher Dan Williams. He previously made headlines for attending an anti-abortion rally after being elected this spring. While his party campaigned on steering clear of social issues, the caucus still voted Thursday to move the bill forward to another reading. Alberta's only doula, a non-medically companion that supports women seeking an abortion, says accessing the service in rural communities is already difficult.
There might not be a single doctor in a small town that is willing to refer. So what is a person to do when they live in these small towns and there's nobody that doctor can refer to?
And could lead down a slippery slope.
To someone who is a practicing Jehovah's Witness who says, I don't believe in giving you a blood transfusion.
This political scientist says if this bill goes any further, it emboldens critics who say the UCP have a hidden social political agenda.
And I think it's going to lead to suspicion. And Mr. Kenny, if he's very smart, will make sure that the private members' bill doesn't proceed any further.
Alberta's opposition leader not holding back words.
I think it represents a broken promise and an attempt to restrict the rights of women in this province.
Alberta's health minister.
Well, conscious rights is already confirmed in the codes of practice for all of the colleges for the health professions. Generally do support the conscious rights of medical professionals.
In a statement to City News, a spokesperson for the College of Physicians of Surgeons of Alberta writes in part, conscience rights are a basic principle for physicians. In our experience, this standard has proven effective in balancing physicians' conscience rights with a duty to provide access to health care services. Williams says the bill is in response to an appeal court of Ontario ruling this spring. That province's court affirmed a lower court ruling that found physicians who objected on moral grounds to contentious issues like abortion must offer patients an effective referral to another health provider. But groups such as the Canadian Physicians for Life says it's still an intolerable violation of their rights. The bill still has to pass second and third reading to become law. However, this doula says Thursday's vote still sends a message.
They will end up even more stigmatized, both in society and by their own healthcare provider, and they won't know who to trust.
In Edmonton, Rachelle Elsiufi, City News.